Okay, so today I've got a special guest on my show today. I've got Areti, and I'm not going to pronounce that second name right, I'm sure, so I won't bother. So, hi Areti, and welcome to the show.
Hi there, it's Areti Malidu Maki.
Perfect. Okay, and we're talking about health cover and health insurance for British people. Well, anybody really moving to Spain at the moment. So, Areti, as most people are going through the non-lucrative visa, there is a policy here in Spain where you need to show that you need health cover for the first year. So, can you just tell us you're an agent for an insurance company, and can you just tell us a little bit about what you do, a rough idea of what you do and what you can provide for people?
Yeah, of course. I work for Sanitas, and it's underlined by Bupa, which I'm sure many people are familiar with, in the UK especially. And what my company is the largest health insurer. Therefore, what we do is we offer plans, healthcare plans for people moving to Spain, and we have them adapted to their visa requirements. So we give full cover, copay or no copay, but usually the requirements are no copay from the embassies and consulates. And yeah, we basically offer annual contracts for people who need healthcare for their visas.
Perfect. Yeah, and one of the questions I get asked a lot, I want to jump straight into this one because it's quite a big one. Some people, when they're applying for their visas, they, get all the paperwork ready and they go ahead and they have to pay for their health cover a year up front. And sometimes they do it a bit too early. And then when they find they present all the paperwork, it's not a full year and they end up paying for it twice. So what do you recommend on that? Is there a way around this?
Well, to be honest, I've had people come to me saying that they already have a cover, and then they want to apply for a visa, but that's not the way to do it. What they have to do in the beginning is to book an appointment with the embassy. Obviously, I'm not a visa or relocation expert, but as far as I know, because my clients usually come from the UK or the US, so I'm quite familiar with the concept. So what they should do is just book an appointment, get the information, and then obviously I wouldn't be able to give them a quote for more than 2 months ahead from the current date. So I always advise people to obviously get quotes from everyone, because you always want to get the best deal and the best coverage. So what I do, I just have consultations with them, and then I speak to them about what their covers, the healthcare covers, and that happens with 2 months. I can give them a quote and a plan if they wish. 2 months, about 6 to 8 weeks before their appointment with the visa office. Not before that, because what they do ask for, I know for a fact, is the visa officers want your coverage to start when the visa. So they have to start when their visa starts. The healthcare has to start the same month.
Yeah, sure. Okay, and now there are some. Obviously, the British people here. Some of them are a little bit older. They're going to be going for this. And are there anything specifically that you won't cover in the health cover, or it might be more expensive or difficult to get covered?
Okay. Well, when it comes to pre-existing health conditions, what happens is this is with, I think, all health insurance in Spain. It's not under my purview to decide what application gets accepted or rejected. So when I have a consultation with a client, I ask them about their pre-existing health conditions, and then we put it in their health questionnaire in the application, and that will go to the Sanitas evaluation department, which is where they decide what goes through and what doesn't. So the options, what I've seen in my experience, is either the office will recommend a higher premium depending on the pre-existing health condition, or they can ask to exclude some services when it comes to specific things, or they might just say it's accepted, and then we can just go for it, because they want to take the risk to insure the person.
Yeah. Okay, and also, a lot of people here have the dental plan as well. Now, you offer that as well to people? It's included,
Yes.
or is that an add?
Yes, we no, we do include dental to our visa compatible plans. We have 30 services included, which is all the radiotherapy and X-rays are covered. Then also we have a free cleaning per year per person in the policies. We have lots of discounts. So if a crown, I know this for a fact because my dentist, who doesn't work with insurance companies, wants to charge me €700 for a crown. So I did check out the other day because I do have the same plan that I recommend people. I have it for my family, and I said, okay, I'm going to go look how much it costs through my cover, and I did notice that it costs €400 instead of 700 to get it done through my health insurance. So yeah, it gives you a great discount.
Yeah, yeah. I mean, the problem being for people when they first move in, they need this insurance. Once you've been here a few years, you get the health cover here in Spain, if depending on the visa you've got, obviously, and what you're doing here. But for me, I'm working here, or I've been working here, so I get the social security health cover. But even so, I go to a private dentist near me. But as you say, it can be very expensive. One of my friends has just had to have 5 teeth done. It was over €2,000 for 5 teeth. So yeah, I think of all the things you're going to get covered for, dental is a good idea. So it's expensive anywhere, but in Spain as well, it's the prices seem to be compatible with the UK, getting more and more expensive. So Areta, you're not in mainland Spain, are you? Can you just tell us where you are?
I'm in Lanzarote, the Canary Islands, down south.
Lovely. Yeah, I know it very well. I've been there many times and love it there. But it doesn't matter where people are. You can cover people anywhere in Spain, wherever they want to move to. Is that right?
Exactly. Everything's done online, and it's pretty quick. If you find the plan and the coverage suitable, we can get your certificate, which is what you need to demonstrate to your visa appointment, in about 48 hours if there are no pre-existing health conditions.
And Areti, also for my listeners, for my followers, any sort of discount? Can you give us a free consultation? What can you offer us as a bit of an incentive?
I do offer free consultations. What I can do is offer a free add-on, which could be, for example, 50% off at pharmacies, which is usually never covered in health insurance companies. So you can have that extra add-on for free. And also, if you prefer the reimbursement coverage, that would be 80% off medical appointments out of Sanita's medical chart. So that's two great things to have in case you need them. So I can give either. I can't give both, but yeah, we can make it work.
Yeah, brilliant. Oh, that's great. Well, I mean, I've been through over Christmas. My wife had she had slipped off a stepladder and broke a thigh bone and a hip, so she had to have a total hip replacement. And it was all covered obviously through the health insurance we got here. But I was looking it up online, and it cost €15,000 if she would have had to go and pay for that. So you never know what's going to happen. So it's always advisable to get a good health cover. And your company is one of the biggest name brands here. It's heard everywhere. And I think people should definitely get a free consultation with you, and you can help them out with any of their health cover in Spain. So thanks very much for joining us today, Areti. Thank you.
Thank you, David.